everybody, and welcome to the SleepDrops Sleep and Wellness Centre. I'm Kirsten Taylor, the CEO, founder and director of SleepDrops and the Sleep and Wellness Centre, and it's my privilege today to introduce you to the newest member of our team, Dr Anitha.
Hi Kirsten.
Hi.
So good to be here.
Yeah, great. I just wanted to take this opportunity to really have a nice friendly chat and explain to our lovely patients what it is you do and how we can help them. I think it's always interesting for people to find out how we've ended up where we are. You know, people always ask me, so what made you fall in love with sleep? And, you know, how did I get to where I am? So we should explore that a little bit more.
Absolutely.
So with that in mind, can you obviously the short version, but can you tell us a little bit about yourself?
Yeah, sure. So good to be over here, Kirsten, and it's so good to meet people and be in a team where you've got like-minded people who have similar outlooks and similar wants and similar passions. So it's a real privilege to be here and to be doing this with you, and of course the rest of your amazing team that you have over here.
We're lucky to have you, so happy.
Thank you. So yeah, a little bit about me. Well, I'm a sleep consultant and I'm a retired ENT surgeon. I've had about 17 years of experience as an ENT surgeon in Malaysia and for a very short time in India. I'm also a certified life coach. My latest qualification I got is what we call a BBTI practitioner, which maybe later on we could maybe talk a bit about that.
Yeah.
And I'm also a Heal Your Life teacher, which is quite different from a very typical medical background. But I see that excitement in your eyes, so I think you know what I'm talking about. But it just kind of makes the entire sleep thing so much more holistic, rather than being either only medical or only maybe surgical based. And that's where I think the whole thing kind of encompasses pretty much what I do. So yeah, what do? I just help people to lead a life of, vitality and joy, whatever you want, simply by actually knowing how to sleep better.
Yeah, but it's more than that, isn't it? I mean, I find your journey fascinating because you just hinted to something. You know, traditionally in the medical model and even naturopathically, although medically there's drugs or surgery or therapy, naturopathically there's nutraceuticals and herbs and things like that. But there's invariably an attempt by the practitioner to try and ascertain the underlying causes, like what's going on for the person, find out what the triggers are and how we can bring the body back into balance. And that as a naturopathic model is something very, that's how we operate. That's our base philosophy. But for you, coming from a medical background, from surgery, where you were taught, cutting is sometimes the only way, and now you haven't just changed to become a life coach and sleep consultant, a very highly qualified sleep consultant, by the way, but excuse me, but more than that, you've actually become fascinated with how we get out of balance and how we heal. And by healing, I mean on all levels. Like you're exploring really interesting things for people, or helping them explore, aren't you?
Yeah, absolutely. I mean, we all know we can control what we are eating, we can control the exercise, how many times we want to go to the gym, and we kind of think that, we've kind of figured out how to sleep well as well. And yet one fine day you think you're doing all the tricks of the trade, and yet at 3 a.m. you're awake and you wonder what else is happening. And I think that's where sleep is just so fascinating, because it's at so many levels, and it really is a reflection of healing.
I totally agree. Yeah. I think it's one of the reasons why I fell in love with sleep as well, is because when I was in clinic over those 7 years developing the initial SleepDrops range, I could see how each individual came in presenting with a slightly different manifestation of sleeplessness or insomnia or conflict or inner turmoil, and how it was presenting as imbalance in their body and stopping them from sleeping, which further stopped them from healing and further made them stress, and round it goes. So, but what made you decide to go I mean, look, you're trained in BBTI, which is the cognitive behavioral therapy, medically recognized training. But What made you go that next level and look into the Louise Hay work and that metaphysical or spiritual way that humans heal?
Yeah, I think our life experiences actually are really our biggest teachers.
Mm.
And, coming from a very traditional Indian background where we were expected to either become a doctor or a lawyer. And
You did one.
Yeah, I did one of those two. And then life starts when you've got your qualifications and everything, and then that's when the reality really hits. And I think, honestly, we never were really very well equipped of how to really deal with other things and which encompass life as well. And so whatever additionally I have learned, whether it was Heal Your Life or whatever, was mainly really for a very selfish reason initially. I just went there to maybe get a little bit of healing for myself.
Right.
And when I saw how, and again, I'm a person who would preferably prescribe something only after I know that it's really good. And once I realized the value that it had in my own life, I said this is something that needs to be spread around to people, because everybody has got their traumas and everything that's going on, and so that's how I kind of went a little bit maybe away. The life coaching thing actually came because when I sit back and I reflect, even when I used to be seeing patients on a regular basis, they would be telling me about their symptoms and signs and all of those things, but I would really like to go a little bit more in depth and find out what's happening. Why is it that this person is developing this illness versus something else?
Yeah.
So I always used to look at them, not only look into their ears or their nose or their throat, but they would be like an entire person for me that I would be trying to see how I can help.
Right.
And
well, that is very unusual for a ear, nose and throat surgeon.
Very much.
Most people just stuck to,
Yeah. And so that's how, everything kind of came together. And that's
tell me,
yes.
where in that ear, nose and throat surgery journey, because of course you must have been having phenomenal results, but I see that you're already saying, even in that process you started to get drawn to the more holistic approach to looking at the whole person. So at what point did sleep, fly its flag and say, hey, I need some more consideration? What made you fall in love with sleep?
Yeah, brilliant question, because sleep is always in the medical world, it's kind of a gray area. You've got the respiratory physicians, you've got the sleep physicians, and then you've got the ENT guys. Everybody's trying to do something about someone who has a sleep-related problem. And so I think my first exposure was when I used to go for multidisciplinary clinics, where we used to have, all of us used to sit together, and each of us would give our input on how to actually manage the patient. And many
Which is
times,
what we do here, by the way.
Yes.
Multidisciplinary clinic,
Yeah.
different clinicians or practitioners all working together to make sure you get great results.
Absolutely.
Just explain.
Absolutely. And that is so important. Everybody has got their own expertise and their own bag of tools, which would, the end product should be that you go back feeling that you've been listened to and that you have a game plan that's been made specifically for you.
Yes.
And I think that's where the whole thing comes in as well, the center as well. For me, I was very fascinated. I did a little bit of research on medical students to see how their quality of life was beginning to get affected because they weren't sleeping well. And interestingly, now studies are actually showing that people who are, shift workers and things like that are more prone to, we know about illnesses like heart disease and things like that, but they're also more prone to something like cancer.
Yes, shift work and cancer.
Yes, and it's proven now.
Yes.
So my heart goes out to those medical students because, hey, I've been there as well. And I think when I reflect back, I can't remember when was the last time that I may have really slept properly. When I was as a full-time practicing surgeon, when you're on call, you're worrying, you're ruminating, you're worrying about, I don't want to miss that call, you've got your handphone by your side all the time, things like that.
The whole world owes a debt of gratitude to all of the doctors and nurses and healthcare workers and airport workers and cleaners and all of the other amazing people that literally put their lives on the line by not sleeping at night.
Yeah. And who are blissfully unaware about this.
Yes, luckily. We wouldn't want to hex them.
So that was pretty much where my whole, my whole kind of interest started off.
So where did you go from there? Once you've decided, sleep's really interesting, and you started doing research with
Yeah.
the medical students.
Yeah.
So what happened after that?
Another research that I think was really worth mentioning, and interestingly, there is a publication just recently as well, is the effect of on the fetus of when the mother is having a sleep-related issue as well. And we started it very early on. That may have been about 7 years ago. And in fact, one of the publications that you had shared actually shows, and that's what's so beautiful about over here, is that a lot of it is science-based as well. And we are very much in tune with what's happening. So it's not like we're sitting in our own small little world. We are very much aware and advancing our knowledge as well, and being
here at the Sleep and Wellness Centre.
Yes,
yes, absolutely.
exactly.
I do confess I have trouble keeping up with the 160 odd scientific studies that come out every couple of weeks on sleep, but they're all so interesting.
Yes.
And they just reinforce what I've already been, living for the last few years, but particularly your point around antenatal or pregnancy, insomnia or sleep disorders.
Yeah.
It's such a tricky topic because prior to all of this, I did my postgrad in natural fertility. So I helped infertile couples become families, right? And a lot of those people naturally had trouble sleeping because, of course, we've got big babies inside us that make it difficult. And I was always really aware that we needed to do all that we could to make sure that mum was sleeping during her pregnancy so that she was ready for the labour and ready for the sleeplessness. Yeah. Not that anything could prepare you, but awesome. So tell us a little bit about, what is the service you're now offering here at the Sleep and Wellness Centre?
Yeah. So here what we typically do, or what I typically do, is when I first see the client, it's really about having a little bit of a direction as well in how it could go, the consultation, but it's also important for the client to be able to voice out what they are looking for as well.
What their goals
What are their goals?
Yeah.
And that's where the whole coaching thing comes in as well, because I could just be saying, oh, you should be doing this, which, forgive me, what typically we get when we go for a medical consult.
Yes.
But it's really what happens in between as well, how you're going to encourage them, how you're going to maybe push them and prod them and make them do what we actually advise them to do.
Well, that's right, in an encouraging and informative way.
Yes.
But also, one of the things I love about holistic approaches to treatment like we do here, and I know that you and I have talked about this before, but like actually chatting to the person and making sure that the advice we give them is realistic and practical and something that they can actually implement.
Exactly.
It's crucial, right?
Exactly. I mean, I just imagine somebody's already sleep deprived. They're coming over here, they're all groggy, and you tell them, oh well, you got to stop having your coffee. You can't have any alcohol.
They're not even going to remember what you say.
They're going to say, well, how do you expect me to even wake up in the morning? So it's really about being really realistic, the way you just you mentioned, and some of them don't want to just speak only about the sleep. Like they come and they just are like, can we not talk about our sleep right now? We just want to talk about something else. Maybe it's a child who's not well at home, or something related to work. And it's important to address all of that, because all of these things are very obvious the reasons why that's, so you may have the best doctor or best advice, but we have to address these kind of not so small things as well.
That's right.
So having said that, I do still use my medical background as well. So if someone definitely has got, like, I strongly suspect that they may be having sleep apnea and things like that, then of course we've got Eden Sleep over here as well. So if necessary, then I can refer them there as well if they need a sleep study. So the initial preliminary assessment always includes that part of it as well. But I kind of call it more of a pre-clinical assessment rather than a real clinical assessment, because I'm not examining them. But it's really at the end of it, when they are done with the consultation, they have a game plan. They have a plan that's being made specially for them, along with the products from here that we have, if they can, then of course in the prescription only range as well, which is actually going to support them on their journey. And many of them, for years, haven't been sleeping properly. And when they come back the second or the third time, they come back just saying, we slept last night like we never slept before. And
I'm always so
amazing.
overjoyed by the surprise.
Yes.
Like they really thought that nothing was going to make any difference. Yeah. But out of some little pilot light burning inside
Yes.
them made them think there was maybe a glimmer of hope, and so they turn up, and
Yeah.
then their whole life transforms.
Yes.
And I just think that's amazing.
Amazing.
So
Absolutely.
fun. So there, I was just going to say, when you touched on how you create the space for someone, so of course you're here to primarily act as their sleep consultant and their life coach and help them become aware of underlying issues that might be stopping them. And I think that there's a real magic in creating that space and empowering people that way. But the world's become a little bit cynical about the word coach, hasn't it? I feel like, I don't know, I mean, is it the Tony Robbins and the Dean Graciosi's of the world? I'm not really sure, but everybody's a coach these days.
Yeah.
But you are legitimately a qualified
Yeah.
medical surgeon who has decided not to do that anymore, gone on and done additional studies at a coaching level. Tell us about that.
Yeah, every second person seems to be either a coach, which is a fact. I mean, you can do a weekend course and you're a coach, or you pay a $7 online coaching program and you become a coach. Of course, I went into the details of making sure that the coaching that I got from was over 6 months, and we had to obviously do a lot of hands-on training as well. And it is also recognized by what we call the International Coach Federation,
The
which
International
is the World
Coach Federation.
Yeah,
Right,
So
the
they,
ICF.
ICF,
Yes,
that's right.
Yeah.
So I made sure that we kind of all the core competencies and everything are all covered. And then it is a matter of kind of putting it together and saying, all right, how do we do it in such a way so it doesn't sound like you're doing a medical consult, and yet you are also supporting the person as well for their sleep as well.
I don't know, you see, I don't think that's necessarily a bad thing. I think people will like the fact very much that you have that level of expertise and understanding at a medical level, to the point where you were trusted to alter people's bodies physically, and you'll be able to bring that knowledge to this environment, but only pull it out if and when it's necessary.
Yeah.
And I think there's a real comfort in that. So,
yes, absolutely. That's, you actually really hit it on the nail, because it's really about that conscience as well, about you knowing that you know it.
Yeah.
If I'm making any sense.
Yes.
And still saying, all right, this is what we need to deal with, maybe a little bit more urgently, and maybe this is something that we can actually try and do over here as well. So
I think it's great.
Having that background really gives a lot of, it gives you a lot of comfort, let's put it that way.
Look, a lot of people have a postnasal drip, or they have an irritating cough, or they have snoring, or they have sleep apnea, and there's all sorts of things that interfere with people's sleep, and they might not even be aware that that is impacting, but luckily, because of your background, you'll be able to help them make that realization, or gently point it out to them. And like you say, because we've got the team from ResMed here who work under the umbrella of ResMed, but they're Eat and Sleep in New Zealand, they do full sleep assessments and CPAP machine and all of those things. So we've got the team here if they need it, and you can be the eyes and pick up on any issues if people need it.
Absolutely.
If not, wonderful. You'll just keep it over here, won't you?
Yeah, absolutely.
So, okay, being a coach, I think, is great. I think, as a naturopath, we always came from that perspective of coaching and educating, and really that's what a coach does. A coach inspires and educates and helps keep the person on the track and motivate them, right? So I've got no doubt that this new reality is really rewarding for you. But do you ever miss being a surgeon?
Oh gosh. Well, yes and no. I would be really, it would be really unfair if I said no at all. But honestly, in those 15 years of being an ENT surgeon, I've seen, like the highlights of my career of really saving a kid's life when the kid may have choked on a fishbone. And it's almost turning blue. A young mom who was still pregnant, and she was diagnosed with oral cancer, and all she wanted was, can I just be kept alive till I deliver my child?
Wow.
And it's a lot, there's just so much more that goes. But I think the ultimate thing is when you're able to, and because it's a ear, nose and throat, as long as a person is, you're able to give them back that thing of, they're able to breathe, they're able to eat, they're able to talk, which is so pivotal. you actually feel that you've done a good job. So I've got some really, really good memories of the whole thing.
Yeah.
But at another level, I realized at some point that I had to give a bit more of attention to my own life.
Yeah.
And so I think it was a very conscious decision when I decided to step away. But having said that, now if I really look at it, the only thing I'm really not really doing is operating.
Yeah.
I'm still dealing with people because I'm so much of a people person. I need to make that difference. And so having all of this, it's just like, it just makes it so holistic.
Yes.
And I love it.
Good. Totally. So what's your vision? Where do you want to go with this?
Yeah. I mean, it's amazing. It's so nice that I'm beginning to meet people who really get my madness. It's nothing short of that.
It's funny that you say madness, because I always express this. I say I'm mad about sleep.
Yeah.
I'm mad about
Yeah.
sleep.
Yeah.
And it's like, well,
Yeah.
are we mad, or are we just like
Crazy, passionate, whatever
in
you
love
wanna
with
call
sleep?
it. Yeah.
Yeah.
You know, and so that is really, really good. My own vision, again, from a personal perspective, is really, I wish I could provide my services for people whose lives have been affected by cancer. That's really kind of my, that little bit of light that's burning inside. And I wish I could give my services to people who really deserve it. And when I say touched by cancer, not necessarily who's being given a diagnosis of cancer, but a caregiver, a child, a survivor, a very good friend, because everybody gets affected.
Yes.
And I really believe that, again, when you are able to control up to a certain extent, control your sleep as well, you are on your way to healing from cancer.
Yes.
And again, I'm not talking only in terms of the physical way, I'm talking about it every way, because cancer it's life-changing.
Yeah.
But it doesn't have to be a death sentence.
No.
No matter what your prognosis is, no matter what stage it is, it's really in your hands. And so for me, I think sleep is such a reflection of how you can move on and go on in life in spite of having a diagnosis like cancer.
I totally agree. I think cancer is very confronting. It's the big C.
Yes.
Everybody immediately goes to the worst case scenario. But even if they're lucky and it's caught early, the treatment is scary. The conversations, the schedule, the going to the appointments, the treatment. It's very disruptive, and it's very demanding on their entire family and support network. And like you say, the friends, the spouse, the children, the parents. It affects everybody, and I know that it impacts on their sleep as well.
Absolutely. And what's really fascinating now, again, is because I think we're in such a lovely, fascinating time where finally research is being made more for something that can be applied rather than just something that's,
Yes.
you just hear about. And now, of course, there are studies which are more and more that are actually proving if your sleep has been affected, you're more prone to certain types of cancer. So even if you sleep too much, you may be more prone to certain cancers. And of course, the whole thing of, your fears of your recurrence and everything, if you're sleeping better, that all kind of automatically does go down.
Absolutely.
And we all want a good quality of life. Even if you are a cancer survivor, you want to go back and maybe create a new life, or you want to go back to the same life, whatever. But you need to have that energy and, again, sleep.
Exactly. And as a caregiver or a support person of someone going through cancer, you have to fill up your own tank.
Yes.
Otherwise, you can't be there. If you're running on empty yourself, unfortunately, you're just not going to be able to be as good a support person as you would have if you'd had a great night's sleep. It's true.
Yeah.
So, I guess that begs the big question. Why are you so interested in helping people with cancer?
Well, I'm a cancer survivor myself. I was diagnosed, or rather I got diagnosed pretty early on. I had my treatment through COVID when we were at level 4 lockdown. If I had to make a column of things which went in my favor and things that weren't in my favor, honestly, I think the cancer diagnosis was really such an eye-opener, and it has been a blessing in many ways.
Many people
Again,
say that, don't
yeah.
they?
Again,
that
would
was
I
a
wish it?
gift.
Would I wish it? And would I say, well, it was the best thing that happened? No. But it was a huge. It really has created me to. It has kind of made me create a life that I really want to live for myself. And people around who are there, who get me, are there.
Yeah.
The others, anyway, never really cared. Never counted.
Yes.
So yeah.
Ultimately, we all deserve to live our best,
Absolutely.
authentic, amazing, joyful lives, right?
And that's how. I mean, let's be honest. How did we connect? It's just I kind of believe that once you are on the right path, you are automatically going to attract the right type of people and circumstances.
Yes.
And that's how I've been feeling since the past year. I'm still kind of I still qualify as under recovery because it's been just about a year.
Yes.
But I'm just too much of a person. I can't be sitting back and not doing anything. There's just so much more to give and so much more to learn and so much more to have fun.
Yeah, but
and I'm actually having fun.
Yeah.
I'm actually enjoying this.
But what it means is that you've been able to take not only your experience as the ear, nose and throat surgeon and a researcher and a lecturer, but now you have cancer survivor.
Yeah.
Like, so when you're sitting here with someone who's going through a similar experience or a similar diagnosis or whatever, you're going to be able to really understand and empathize and give them the space that they need.
Yeah.
Right?
Nothing can minimize the grief, whether it's a grief of a cancer diagnosis or anything. Anything can be a grief. And I think if I was, kind of still a practicing doctor, I think I would have just been so different had I had this experience before.
Right.
But it is what it is.
The timing's perfect.
Yeah.
So, last but not least, is there something that you would like to share about you that not many people know?
Yeah, interestingly, I kind of still consider myself to be an introvert, which means that I need a lot of me time. Like, I can recharge only when I'm left alone. And so I have really, again, I've carved out a life where I make sure I have enough of my own time. My idea of an ideal day is really reading a proper novel, because I'm still not so much into ebooks. With my puppy that I just got about a month ago, and just by the beach, maybe a glass of wine, although of course I'm not supposed to be having
not
wine,
in the morning.
but who cares? And that's pretty much it. There really isn't anything else much.
So you take the time to refill your own bucket, refill your tank, and then I've seen you with people. You're joyful, you're giving, you're kind.
Thank you.
So yeah, it's nice that you're taking the time to do both, because you're really walking your talk. So when you say to people, make sure you make time, you're making time for you too.
I had to, Kirsten. I had to learn it kind of the hard way.
Yeah,
I had to really put in all these so-called qualifications and experience and really use it every moment for myself. And I think what we're doing is just something so beautiful and unique, and I find it extremely inspiring. Like, I look forward to coming here every day, if possible.
Well, we're very lucky to have you. So,
thank you.
Listen, lovely chatting to you. I hope that gives our visitors to the Sleep and Wellness Centre website and wherever else you may be watching this some insight into our lovely Dr Anitha. And we welcome you anytime. We'd love to help you. If you have any inquiries at all, just email info@sleepandwellnesscentre.co.nz or email Dr Anitha directly. Would you like to spell out your...
Definitely. Thanks, Kirsten. It's Dr Anitha. It's ANITHA @sleepandwellnesscentre.co.nz. My phone number is available on the website as well. So it's really about, you can reach out from whichever corner of New Zealand you may be in, because there is an option of even doing it via Zoom or online, because it's really about getting these services out there to as many people as possible.
Yeah, we really genuinely mean it when we say we're here to help you. So please reach out. Thank you.
Thank you.
Anitha.
Thanks a lot, Kirsten.
Good.